Here's a kid, 20 years old, and he came to me. He was already diagnosed as bipolar disorder. He had had this sudden manic episode at college. He was going around the class wearing only his bathrobe. And he'd go into the class and he'd tell the professors, see this self-referencing thing of the excess in the Shen that we talked about earlier? He'd tell the professors that soon they would realize how insightful he really was, that people just weren't recognizing his brilliance. You know, this is clearly yang Shen disturbance, right? He's going to tell you, you know. And he was the only one who really understood the nature of how things really were, you know. He did admit to using marijuana. He denied any other drug use. His parents, in fact, talked to his college roommate and his girlfriend. You know, his girlfriend recently just didn't know how to deal with him anymore. It wasn't like they had had a breakup that triggered this, but his girlfriend was like, wow, he's just a different person all of a sudden, you know. But his roommate said, yeah, he wasn't. You know, they were smoking pot, but nothing else. He had this staring, wide-eye expression. He was talkative, but he wouldn't respond to your questions in a clear way. When you'd ask him questions about his experiences or what he was thinking or whatever, he would sort of just answer something else, you know. And his parents had found that as long as they didn't do anything challenging to his behavior, he would be relatively calm. But that they would ask him to get dressed for the day instead of sitting in underwear or something, he would have an outbreak, you know. And so they brought him home. He was sitting around at home watching TV. He had a big appetite, didn't gain weight. Really skinny kid when I saw him. Liked to always snack on chips and things like that. And of course his parents, his parents were friends of mine. They brought him. They were so frantic, you know, and his behaviors upset them even more because they were thinking, well, if he would just eat good food, that would help him get better, you know. So of course that was challenging to them. But this is typical. There was some split. I interpreted this as what we've been talking about. The spleen, unable to transform. The heat was building up, and so he has heat, phlegm, and spleen deficiency. That three-part. His tongue was red, had a thin yellow coat. His pulse was kind of full and rapid, so we could see all the heat and phlegm. And I think there was some chi deficiency underlying that. And so that's how I treated him. And in fact, his behavior became a lot better, and he never did start the lithium treatment that the MDs wanted to use with him. And now he's back in school. He's gone he was actually going to UCSD, quite a good University of California, San Diego, very difficult to get into. This is exactly that case I'm talking about. He was a very good student in high school. It was easy for him, and suddenly it was very challenging in school there. And so now he's going to culinary school. He's doing great. Very relaxed. Doesn't feel, you know, he likes what he's doing. You know, it's a level of challenge that isn't overly depleting for him.
Do you think it was triggered by a bad diet?
I'm sure that diet played a role in injuring the spleen and also helping phlegm to accumulate. I think it was overstress was injuring the chi, and right. I didn't see him as liver type. He didn't have a wiry pulse. He didn't have aggressive behaviors. We could have thought, is there, but from the stress. But I didn't see that so much, you know. And as I say, what I did is I gave him a mixture of spleen chi tonics, heat clearing, and phlegm clearing, and that seemed to really bring him back to. I actually made a formula sort of based on what we had mentioned earlier, the Bancha Baiju Tianma Tang, going in that. So I went in that direction, you know. And then points-wise, I used points like pericardium 5 and stomach 40 and spleen 3. I really like that combination there, stomach 40 and spleen 3. Clearing phlegm and tonifying the spleen. It's sort of low point, source point now, you know. And do 20 with moxa, in fact. Even though he has heat, do 20 with moxa tends to normalize the sea of marrow. As we mentioned earlier, filling the marrow up in sleep disorders and stuff. I guess I sort of glossed over that back at some point ago when we were talking about that sea of marrow, and I said I always treat that in older folks with yin deficiency. I often treat it with moxa. So that's counterintuitive. Here's a person with some yang rising, making their heart disturb, but moxa on DO20 is not harmful for that kind of person. It actually makes their brain function more normal.
No, I just thought that was one of those not to be done points.
Yeah, that really is counterintuitive.
It is. What?
Yeah, but in fact, what you will find in patients who have mental disorders and brain dysfunctions and all, moxa on DO20 will not cause more yang rising. It somehow makes the brain function better. And my teacher would say, it actually builds yin for them. It brings the sea of marrow back up, which is really all that yin substance can fill up there again.
It's very relaxing.
Yeah, have you tried that on people who are like can't sleep and stuff, and often they get so almost like they actually often tell you, boy, that made me really tired when you do that, and it takes away that yang thing. So I recommend, especially as I said, the two cases for sleep disorders you definitely have to do that are children who can't sleep and elderly people who can't sleep. You have to do moxa on DO20. You'll really like it. It really helps them a lot. How elderly is elderly was the question? When you're inclined to diagnose a patient's sleep disorder as due to kidney yin deficiency and you see that affecting their physical structure, that's how I would define the elderly for this case. Discs thinning, their skin thinning out, they're getting a little dry, physically as a result of that yin decline. That's when so we see, this is a clear yin deficiency type of sleep pattern. Try the moxa on DO20 for that person. And they may also be telling you they're getting a little bit forgetful. And you might think about then giving them brain tonics. That's a case for the formula Huan Xiaodan. Huan Xiaodan, recovery of youth elixir, is a really useful formula for people in that phase. They're having some sleep disorder, they're getting a little bit forgetful, and similarly to using DO20 with moxa in children, I use that same formula, recovery of youth, in kids too, when they're in that pattern. And what is that formula? The main herb is Shen. Shen is kind of qi tonic and yin tonic, and it's really neutral in a way. It's not overheating or something. It's really easy. And then there's Shi Chong Pu in that formula. It benefits the brain, it clears the thinking. So look for Huan Xiaodan. You'll like that formula for old people when they're just, I'm not talking about senility here, dementias. We're going to talk about that. But just to help it make your brain better when you're aging, and kids too. Learning disorders where it's kidney related, I like Huan Xiaodan a lot. Prescribe. It won't overheat somebody. They can take it for a long time. There was a hand somewhere and I skipped.
I was just wondering with the moxa, indirect moxa.
DO20, I tend to use indirect just because it's inconvenient to try to do direct moxa on DO20. I use indirect, but there's no contraindication to doing direct moxa there. In fact, it might even be better effect-wise, but it just if they have hair or whatever, it's a little easy to do indirect moxa compared.
What about needling with the moxa on the needle?
I would say, talking about sort of just your own personal biases with technique. My tradition, my family tradition, because I'm sort of stuck with that, is that it's always better to needle a point before you moxa it, my teacher would say. But moxa on the handle of the needle is for a specific effect. So you might put the needle in and then use your pole moxa or something like that. But if you're going to do that thing of putting moxa on the handle of the needle, that is called a double technique, meaning that it is dispersing and tonifying at the same time. And so he would say that technique is especially good for deficiency damp. So if you think that this is in the brain, it makes perfect sense to do exactly as you said, to put it on. And we said that, didn't we? That it could be spleen deficiency with damp accumulate. But where do I use that a lot? Like in deficiency damp in the joints. Then moxa on the, and it's quite interesting. I was actually involved, this is many years ago now in China. One of the hospitals I was working in was doing a study on that very technique. And they developed this, they had this temperature sensor they clip on the needles and stuff. Moxa on the handle of the needle does not transfer heat down the shaft of the needle into the point. It doesn't. The needle, the heat is dispersed very surface at the skin level. So it appears to be no different than moxa. It doesn't seem to have a different effect. And what they came up with is that it actually changes, this is all pseudoscience now, because it's this explanation, but it's an interesting, they said, look at what happens when you take a needle. I don't know, you can't tell what's true here because we don't know exactly all the impacts the needle has. But normally we have the skin surface, we have a needle in place, and there's actually some kind of activity being generated by the needle, part of which is actually electrical. And they've measured this, right? Those guys up in McGill and Bruce Pomerantz have measured all this electrical potential change that happens from needling and all that. Well, in normal circumstance, the cool here versus warm here, and it produces a current flow in a particular direction. But when you, because that's the way a conductor works. When you change temperatures along a conductor, you get a current flow. Now, if I put moxa burning here, suddenly this becomes the warm part relative to this. The current flow is in an opposite direction. So that may be, there's some kind of mechanism like that, That was their conclusion. It was in Shanghai years ago. They said, our conclusion is that the moxa on the handle of the needle must not be a case of actually warming internally, but actually something about changing some kind of differential here. And so but the classical theory is, and as my say, this is, the needle is dispersing the damp while the moxa is putting in the normal qi, the zheng qi again. So for qi deficiency with damp, that's where this technique excels. So it's given me a strategy then for when I choose this technique. As a final conclusion to your question, I would always needle the point if I could. If it's a kid or something, you want to avoid the needles is one thing, but if given the freedom to do it, I would needle the point first to activate the qi and then put the moxa on. And whether you do it direct moxa or indirect is kind of your style, what you like, what the person's accepting of, Yes. Even the back shoe points, the upper kidney points, or any of that, I know that there are a lot of traditions that say, needling upper back points up because the yang disperses so quickly, but you're doing short time retention there because you put the needle in, you take it out, then you put your moxa on. So I'm not worried about dispersing the yang or something accidentally.
There was always an expression, the upper kidney, you must warm the heart before you invite the guest. So you did the moxa first and then you ate them. Yeah, my tradition, they never did. In fact, like points like kidney 27 and stuff like that, very common for my teacher to needle the point. His mentality was, we have to kind of activate the qi and then the moxa really has more impact. So it was his strategy, So you took the damp, you moxa after you took the needle out?
Yes, you needle the then put your moxa on there with the idea of the point is now active, the moxa is good, rather than he never liked just moxing a point that hadn't been needled. He says, it's hard for the moxa to create the level of activation right off. You need to kind of get the qi active with the needle and then put your moxa on the point. That was just his strategy. So it just became a habit of mine to do that. You're always stuck with that, aren't you? The sort of things that your teachers do and you just start doing it. There's so many variables. It's chaos theory. It says there are so many variables, it almost looks random. It's not really random, but it's hard to figure out. I can't judge exactly what's happening, which way would be better. I needle, or maybe I don't have a way of, so I'm stuck with a style of practice. Works okay, so yeah, it seems to work. Don't fix what works, just So that was we went into that whole discussion then from Andrew's question about why do we sometimes see that appearance. And by the way, another thing that happens when you are in the fire time, this is not mental disorders per se, but we've been talking about lingering pathogens. When you're in the fire time, if you get an external pathogen during that fire phase that we see during your adolescence, it's much more likely to make that later will give you autoimmune disorders and things like that from a modern sense. And there's been a lot of Western noticing of this in biomedicine that predictably people who have autoimmune disorders like MS will have had a significant febrile disorder during adolescence. Like mono, other, even strep infections, things like that. That seem somehow not so consequential over the long term. They get better. And yet later they start to show more autoimmune disorders. This is typically, in our understanding or our view, a latent heat pathogen. Somehow it gets more dramatized because you're in the fire time. That pathogen that gets in there tends to generate that latent heat easier, that's lingering and building up in the body. And so, of course, if you have any suspicion of this, I often look for signs that then you want to do something to clear that latent heat from the body. I think you really protect her example of mono was a good one. You often see slightly elevated liver enzymes ongoing after that. And they say, the Epstein-Barr titer is higher if you look for the antibodies and all that stuff. In those cases, I always like to clear liver heat. We start to see the liver enzymes really staying at a normal level, or even if the liver enzymes look normal, but you have some suspicion that there's an ongoing impact. Slight fatigue, chronically swollen lymph nodes, maybe just more frequent appearance of common colds and the like. Something like that seems to follow this initial event. I'm suspicious. I need to clear that. So, for example, we can use an herbal formula like even something as simple as yin chao san, but just done in a preventative way. I worked with the last time I was in China, last October, I was working with a fellow in the pulmonary department in the hospital, and he was in charge of the SARS control in Shandong province. And they used a formula as preventative based on three simple formulas combined. And that was Yu Ping Feng San, Yin Chao San, and Dang Wei Bu Shui Tang. So they did this triangular arrangement in this way. What is Yu Ping Feng San is surface release, right? And the idea here is that we're going to take qi up to the surface to build better wei qi. And then Yin Chao San is about getting rid of heat pathogens, and really it's about getting rid of heat toxin accumulating. They actually thought it was the Jin Yin Hua is the most important herb contributed here. So you basically have Huang Qi, Bai Zhu, and Fang Feng. That's your Yu Ping Feng San. Then we said Jin Yin Hua as the main herb contributed by the Yin Chao San. And then what's left over? The Dang Wei Bu Shui Tang is just two herbs. Huang Qi is already there. And they found that this combination proved to be the most preventative for lung infections in Shandong province. How to say exactly? SARS, not SARS bigger, but just as, so better than Yu Ping Feng San alone was to add these other, and it's interesting, the theoretical view was the Dang Wei, building blood, supports the Wei Qi. And if you don't have enough blood, the Wei Qi collapses. So this is a theory that often gets not so much attention, that the Wei Qi, yes, is Qi coming from the lung primarily, but it floats on the blood coming from the liver. So if we have, then the Wei Qi is supported. So think about all the uses this has now in your clinical situation. How about all of the Wei Qi vulnerabilities we see in patients premenstrually, stuff like that. This is because there's. How about all of your pregnant patients who get Bell's palsy? Bell's palsy way more common. Facial paralysis way more common in pregnant women. Even though classically in the West we've called that thing chauffeur's disease, right? Because it was back in the days when the chauffeur drove an open car, you know, and would get the cold on their face, right? But in fact, if you look at the epidemiology of Bell's palsy, it's quite common in pregnancy. It's not enough channels, and then the Wei Qi can't protect from that invasion of external evils. So this notion was, and interestingly, the practitioners in Shandong who were using this formula were in a debate with the practitioners in southern China, where the SARS was more. The southern Chinese practitioners didn't use these three, they used these two, Yu Pingfeng San and Yin Chao San, but instead of Dan Wei Bu Shui Tang, they used Wo Xiang Cheng Qi Tang. They said this is what they felt was, I bet it's something about climate difference, patient population, different areas. They were saying, we've got to clear this accumulated stuff in the middle warmer in our patients to make them less vulnerable.
You were in the South?
They were in the South, yeah, like down around Guangzhou and stuff. This was their formula. Was they used three things, but they had all that damp summer heat kind of, and they were using this Hoxiang formula as the. So I think we can. I think this is instructive for us to look at how could we protect the person. It makes sense to boost the Wei Qi, move the Qi up there. It makes sense to make sure there's no toxin there. It might make sense for a lot of our patients to make sure they have enough blood. It might make sense to regulate that summer heat and food retention and all that, maybe dampen the environment. To think about where you are and what your circumstance is like.
So these three formulas, in a way, for these autoimmune disorders that we are talking, could be this combination interesting?
Yeah.
Right?
Yeah, it could be interesting for them as a preventative thing. Once the person's in the throes of the autoimmune disorder, you've got to treat that directly, however it's coming out, where that heat is, and if they've got lupus or whatever. But we're thinking here, some kind of pathogen gets in there. We've got to make sure that doesn't keep generating this low-grade heat that's going to erupt out later, this crazy autoimmune phenomenon.
But when they are in the phase,
when they're in the throes of the autoimmune disorder, then we have to think more of how it's, like for example, rheumatoid arthritis. Where does that come from? That's often some kind of, what do I use for rheumatoid arthritis most is Guizhi Xiaoyao Zhimutang. Guizhi Xiaoyao Zhimutang. My favorite rheumatoid arthritis formula. What is that? It's a weird formula. It's Guizhitang, first off, right? But then they add to clear heat and strengthen the kidney yin, and they add futsa, which opens the vessels and moves out the obstructive cold. So the fact, why did this autoimmune disorder come out as a blockage in the channels where we're getting pain and inflammation? This is typically what I use. Now think about, how can I translate that? What if I'm not going to give them this herb, but I'm going to do physical treatment? It means we have to unblock the channels and remove cold, like the futsa does, like the Guizhi does. But at the same time, we have to tonify the yin, especially of the kidney, because that's what stops the inflammatory process of the bones. Heat in the bones, and that's what rheumatoid arthritis looks like. The channels are all blocked, and there's lots of pain, and at the same time, there's all this heat in the bones and connective tissue, and it gets red and swollen. And so you need this kind of dual direction. So maybe we do local treatment kind of above and below the inflamed joints and really try to provoke the qi movement there, while we're choosing other points that more systemically tonify kidney yin. And I bet you that tonifying of kidney yin is part of why it tones down the latent heat of the triggering pathogens that get you set on that. Sure, we can say, there's family tendency for rheumatoid arthritis, but it gets triggered at some point. The genes that predispose you to that get activated at some point. I think in a lot of my patients, it's a latent heat pathogen that triggers that. And then, so as I say, this is my favorite formula for rheumatoid arthritis. I had a good case, somebody who responded so well to this. She had rheumatoid arthritis that was of many years duration. She already had a lot of deformity of the joint, and the modern drugs, even things like Enbrel and these kind of immunosuppressants, weren't helping her. So they went back to giving her gold injections. Very old-time therapy, in a way. And that was somewhat helpful, but it's toxic, you know? That finally provoked her to look for alternative treatment. And she responded really well to Xiaoyao. So it's, in a way, this formula is simple, but you can see it's really a combination. Now we talk about our pivots again, that list of things we started to go through, our qi mechanism. This does it through mixing strong, hot, and cold herbs, and then something that opens the little vessels. So that's really going to break through obstructions, yeah, and move the blood. And at the same time, I think the Zhimu is so useful for building kidney yin and cooling that latent heat. I always recommend tattoos, though, if they're going to do pediatrics. It's really, the kids love that. So, may not be necessary if you're specialized in other, but if you're gonna be doing many kids, I recommend, and then show it to the kid, and then draw one on them, and then tell them, come back when they're older, and you'll take them to get one, don't bring their mom. You can always see the change in her look when you're telling the kid that. Oh, it's so much fun, and they really like it, you know, so. Okay, let's see. Let's go back to our. We kind of digressed a lot there. Let's progress a little bit in our orderly way. We were talking about the 4 C's. All of these are areas where we have, like the Xiao Yin. We talked about Yin and Wei. We talked as the Guizhi Tong thing. We talked about Xiao Yang. That's your classic Xiao Chai Hu Tong kind of thing. And then we have the Xiao Yin. Heart and kidney, right? And we have to maintain that connection of heart and kidney, and they often dissociate. So that's one of the pivots. And so it goes through. Taiyang is the surface. When we talk about the 6 layers of the body, we should always see the 6 layers as a kind of if we take a transverse cut across the body. When you cut the body that way, you will see there's the surface of the body, and then there's this hole down the middle, the digestive tube. The very surface is the taiyang. The digestive tube in the middle, and then what's this stuff in between? It's the xiaoyang. So these are the 3 yang layers. A very surface layer, a digestive tube in the middle, and an intermediary layer between. The taiyang and the yang ming actually meet at the mouth and at the anus. That's kind of how the body is structured. And if this is of an interest to you, you should look at what in modern embryology are called the 3 germ layers. The 3 germ layers are the 3 basic structures through which all of an embryo forms. You have an ectoderm that generally forms the skin, an endoderm which forms the digestive tube, and a mesoderm that forms the intermediate layer. And it's from the mesoderm that all of the organs develop. So very primitive animals, flatworms and the like, have almost no mesoderm. They just have 2 germ layers. They don't have much in the way of the organs in between. The more developed an animal gets, the more this Shaoyang layer develops, this intermediary layer, and here's where the organs are forming, in here. So there's kidneys and lungs and hearts and stuff floating around in that intermediary layer. So we often see diseases move through these layers in some way, like Taiyang can move to Yangming. They actually join at the mouth and the anus. And when you look at the germ layers, you will see, oh, the endoderm is forming the digestive tube, but it doesn't form inside the mouth. That's formed by the ectoderm. So that's still part of the Taiyang. The same with the anus. And so isn't it interesting, we often say that, like, the anus isn't part of the intestine. It's actually ruled by the kidney. Really, it's ruled by the bladder, by the Taiyang. It's part of the... And so then, so now you can see why there's such a debate about which order do we put these things in. Well, in a way, any order here, it can go Taiyang to Shaoyang to Yangming, can go to Taiyang and then to Yangming, then to Shaoyang. And then, so this is one of those pivoting things of the body. Between the Taiyang and Yangming, the Shaoyang is also in it. And then we can see the Shaoyang touches both Taiyang and Yangming and touches the organs. And then the yin layers differentiate. You've got like lung, which goes to the surface, and spleen, which goes to the digestive tube. So the Tai Yin ties these layers together. And then you have heart, and so heart should be in here, ties to the small intestine as part of the digestive tube, and kidney is out here, ties to the bladder as part of the Taiyang. And so we could actually say within the Shaoyang layer, it divides into qi and blood levels. Lung and kidney are in the qi level, heart and spleen are in the blood level. And then finally, you've got that Jue Yin thing connecting from the inside back out. Right? So that's kind of how these things are ordered. I don't know how relevant to our discussion of mental disorders strictly, but it's sort of how the qi mechanism of the body is arranged. So as we work through this, we see this Taiyang, Yangming, we see the Shaoyang, the Shaoyin, these kind of connection that the qi mechanism has to maintain. We have this is very important for our mental disorders. The stomach isn't going down. That excess easily rises up and harasses the Shen. So stomach heat causing Shen disturbance, food retention in the stomach causing sleeplessness, stuff like that. Finally, though, in relevance to your question, we get down to the Hun and the Po. The Hun is about taking, as we said, taking our psyche outward. And the Po is about connecting inward and having a balance between others and self, and others' interest and self-interest. And that's psychologically one of the qi mechanism pivots. How much do we take? So people with a lot of fire tend to be overly concerned with outward moving and outward, and people with deficient more inward moving. And it makes you wonder, this Hun and Po difference, what determines whether a person is going to produce violence towards another person or violence to themselves, like cutting behaviors and stuff like that. And it's said that violence towards others is Hun related, and violence towards self is Po related. So when a person is involved in, say, cutting, just like we see with teenagers, where they get all that frustration, but then they cut themselves, rather than acting out towards another, we could say what we think happens there is the frustration is the liver qi constraint, lung deficiency. So that qi constraint overacts on the lung and they goes inward instead of coming outward. We were talking on the break about a patient who had what we were thinking was some kind of liver stagnation producing that running piglet thing. And he had that upward, and he was getting this sort of spasm in the esophagus or something like that. And yet it wasn't responding well to liver qi regulators. And I thought, I wonder if he has some lung deficiency, because the lung does have a big impact on the esophagus. And we often see, when you see excess showing up somewhere, respond to clearing of the excess, it's often because the place where it's showing up has some underlying deficiency. And so we would see that the lung becomes vulnerable to that liver constraint. Like that's also emotional asthmas. Often we see excess liver, deficient lung. Somebody gets an emotional asthma attack. And, like some event happens in life, they can't suddenly breathe. It's that liver constraint going. They have to have some lung qi deficiency to make that vulnerability happen. So this Hun-Po balance is, say, between... I've wondered, I don't have any classical references that say this or anything, but could this even be extended then to the point of when a person becomes a murderer versus doing suicide? Is it the person who commits murder has all that Hun heat, suicide, they must have some kind of Po aspect, so they direct that back at themselves. Despite the fact that we can say, well, there's all that attention-getting aspect of attempted suicides and stuff, but directing aggression back at yourself must imply that that Po that is imbalanced and is vulnerable like that. So that's one of these important kind of balances we have to try. Let's mention one more before we go off this page, and that's the spleen liver, because my old Korean mentor used to make a joke about that, saying that really this is one organ. It's called the sliver. Again, his English was terrible, but he came up with that joke, that the sliver, because he would say, look, the way the body is formed, you have 2 kidneys, 2 lungs, a heart in the center. In modern understanding, we even see the 2 sides of the heart and all that. And yet, we then have a spleen on one side and a liver on. That's like weird. In fact, those are one thing. And that's why it's such a stress for the body to always try to maintain this balance between spleen and liver. And that's one of the fundamentals of the qi mechanism, to try to keep the spleen and liver balanced. And that any disruption of the qi machine, you're going to see the spleen tend to get qi deficient and the liver get qi excess, and this imbalance then produce symptoms. We certainly see that a lot clinically, and it was the first question when we talked about that patient I had that esophageal spasm and stuff. That they have liver overacting on stomach. How about some Chayu Shugan Tang or something like that takes the pressure of the liver, and of course that's so obvious and already been tried and not responded. So they want to see why is that still producing that cramp there. I had a patient a while back who was having what they were calling neurogenic swallowing disorder, where he would have this strange sensation, not plum pit exactly, but he would get kind of discomfort with swallowing, and then he'd start belching as a result. And he got various diagnoses: esophageal spasm, diaphragmatic spasms, this and that. The Western guys had tried, all the typical anti-reflux medicines, and the Zantac and all that nonsense, with no result. And they sort of shrugged about it, and so he eventually came to me for alternative treatment to see if it would help. And I tried that same way. I'm going to take the liver off the stomach. Didn't do a thing. And he responded to lung tonification. So I think that was the case of where, yes, he had liver stagnation, but he couldn't resist the pressure upward from that until we tonified the lungs. All the qi regulating just didn't stop that. And, your typical things for that kind of, your P6 and bladder 17 and Ren 15 and stomach 36 and gallbladder 34, the stuff that should have harmonized that with points, and then the herbs like the Chayu Shugan, they just didn't do anything. What's your experience? Is Chayu Shugan better for men or women versus Xiaoyaosan? What's the difference between those formulas when you think about them? Chayu Shugan is more qi. It's liver qi stagnation in the middle warmer, whereas Xiaoyaosan is called a harmonizing formula. It's got a little more blood tonic aspects. It's got some phlegm clearing besides the moving of the liver. So I would always answer that that Xiaoyaosan is more for women and Chayu Shugan Tang is more for men. But in fact, Professor Wong, who we started our day with that case of Great Trunk, swears it's the opposite. He said he always finds...
For myself, it's opposite. And sometimes I think you have to look at the micro and macro environment as well. And me being a single dad for the last 20 years, a lot of my lifestyle has been that of a mom as well. So I don't... Sometimes you got to expand.
Yeah, that's good. We have to look at the individual circumstance of a particular patient, and maybe even then we can generalize about particular patient population. Is Professor Wong's patient population different than mine? But that's, I just asked that because he said that. He said, oh, I always like to use Xiaoyao-san with men and Chayo Shugan. And I'm like, really? Again, he's not the kind of person I could argue with, so I'm just, it's interesting. Thank you for that. You know.
Do you have a favorite formula for that? Just total vital lungs for men?
Oh, I usually just use, a basic chi tonic formula. I like to have Huang Qi in it because it raises the chi up to that level. I can't say a specific formula. So that page that listed all the name disorders, despite the fact that there are so many name disorders, the set of actual syndromes that cause them is fairly limited, as you see here. The first one, we've been talking about lingering pathogenic factors causing heat and dampness. The second one, kidney yin deficiency with empty heat. The empty heat going up disturbs the mind. Remember the characteristic you look for in this, kidney yin deficient patients may feel lack of self-worth. They may feel distractible and upset unless the environment is just right and not overstimulating. They become very intolerant of stimulation. We often see this in patients who can't stand noise, can't stand any kind of, light in the environment or things like that. That would be really characteristic. And certainly we see this with aging. The old people fall into that pattern. Extreme chi deficiency, why they say extreme here is because for it to collapse enough to really affect the mind means the depletion of chi is quite significant. Brain damage with blood stagnation in your traumatic brain injuries and stuff like that. We'll look at a case tomorrow morning about schizophrenia, a young girl whose schizophrenic episode started to happen after a car accident. A great patient because her particular delusion was that electrical apparatus had consciousness and she would carry on full-blown conversations with electrical things. It was so interesting because I thought she should go into appliance repair. She could just ask the refrigerator what's wrong then, And I mean, wouldn't that be handy? Heart and kidney not communicating. As we say, this is so important for our post-traumatic stress disorder, is the heart and kidney get disconnected. The spleen chi and heart blood deficiencies, overthinking, stress, overconcentration, overstudying, all of that, depleting the spleen chi, as we talked about that case earlier of the woman who went back to school. Generates an upward movement of phlegm or dampness, clogs the mind, clogs the brain, and I think of this as related to our discussion of water amassment coming later, that these two are very similar patterns. Somehow anything that obstructs the water channel gets this blocking of clear thinking. Of course, liver chi stagnation initially produces frustration, and then that goes towards depression as one of our chi stagnation, creating frustration, and then the affect gets held in and creates chronic fatigue in a physical sense. Liver fire, you always see aggressivity with this, outbursts, lack of emotional control at all. Heat in the stomach rising up, harassing the heart, can produce very bizarre behavior because when the stomach heat goes up, there's often food retention, a lot of phlegm amassment from that, and this is where they always say this produces those funny, bizarre things of can't keep your clothes on, you're always singing and yelling out, you really like high places. That's the classic for stomach heat harassing the mind, isn't it? You like to go to high places, take off your clothes and sing. The characteristics of that stomach fire rise. We don't have to hold out for those symptoms, but yin and yang separating. Hey, this is a big one in menopausal women. Menopause causing anxiety, sleep disturbance. You even see menopausal hallucinations. that are due to this yin and yang separation. And things that reunite yin and yang, very popular formula, Wu Mei Wan. Wu Mei Wan is the sour plum pill, and it actually is for reuniting yin and yang. It's classically used when you have a menopausal type thing with hot flashes and headaches, but cold, tired, weak legs. But you can also see it very useful in mental disorders. It's that yin and yang separating. Lung, qi, and yin deficiencies can produce sometimes worry, sometimes grief, sadness, and then jing deficiency, as we mentioned, producing a decline of mental function. Tomorrow we're going to talk about senility and dementias of age and stuff really fit that case. We'll talk about the different kinds of memory and different kinds of memory loss. So my plan for tomorrow is we're going to go through some interesting disorders like emotions and orthopedics, emotions and eye disorders. But then we're going to work right through all of the named mental disorders that we had on the list. And so the senility and dementia stuff is on that list. And somebody asked that we make sure to pay a little more attention to post. I'll try to do that. So that's our plan for tomorrow. Any questions? Yes.
Did you touch on water amassment?
Water amassment, I sort of put it together with phlegm, misting the mind, or blood, and that's when your body isn't transporting water efficiently. That water accumulates, and it blocks normal thinking. As I said, there are various types. One type of water amassment is when there's not enough qi or yang to circulate it. Another type is where there's actually yin deficiency, and we're accumulating sort of that bad quality fluid somewhere, as we talked about earlier with the Zhuling tongue. In either case, you've got to open the water channels and get the water moving. And it's why herbs like Zhuling, Fuling, Zixia, these kind of herbs are actually not diuretics. They actually make the water move properly in the body. And so they're not going to weaken the kidney like giving the person a diuretic would for water amassment. We can think about that more tomorrow. Okay? All right.
Thank you.
Thank you.